My name is Aiman Soomro and the topic for today is drug effects and drug interactions and the factors that modify them. The subject is pharmacology. This is DVM batch 1 semester 3. So here is our table of contents. We will start off with introduction, then how drugs work on body, factors affecting drug absorption, drug elimination, genetic and age factors, drug interactions, common interactions, and importance of personal health, and then we will do a summary. So number 1 is the introduction. So basically, we will have an overview of drugs and the interactions. In this, we will see what drugs basically do. As we all know that drugs are substances that we take to treat ourselves, to have any effect of soothe or calm, to treat ourselves, to relax our body, and to heal from any illness or diseases. So basically medications, they are made up of chemicals, they have receptors, they have enzymes, and they have cellular structures, and these, when we take them inside our body, they get metabolized by our systems through our GIT or through our gut or lungs. It depends on the route of administration. And then we have to know that each medication that we take or the drug we take, what its effects are. We will be going through those. It is important to understand that how drugs work, because not all drugs are beneficial to us. Some may have adverse effects, some might try to harm us, some may lead to poisoning, toxicity, and can even cause death. So we will be studying on this, how the drugs absorb in our body, how they go through our systems, how they reach impacted sites, and how they are then eliminated from our body, how the drugs can affect each other if we are taking multiple drugs at a time. And we'll also be understanding what are the risks involved with it. So if we understand how drugs work in our body, we can improve our healthcare systems. We can know that if some drug is having one reaction with another one, that way we will not take them together, and this will improve our healthcare. We will also know if for any illness, what kind of symptoms we have, so which drugs will be better suited to treat us. So how drugs work? We all are familiar with pharmacokinetics. This is basically, there's an acronym here for you. It is ADME, which is ADME. A stands for absorption. In this, we will basically know if any drug is entering the body, how it will enter, where it will go, and what will happen next to it. The second is distribution. Once the drug is inside, where it will go, how it reaches there, and the metabolism. If a drug has entered, what will happen to it that we can get the full effect from it. And then lastly, elimination. Once the drug's purpose is done or the time period is over, the drug shall be eliminated and our body will go back to its normal state. So there are multiple routes through which drugs can enter our body. These can be through oral, can be through intramuscular, intravenous, and there is you can even enter through the skin, like the thermal ones and the dermal ones, So, but I will be explaining over here the oral route. So, once we take any medication, it will enter our body through our oral route, and once it's entered, then it will go into the stomach, and from stomach it will go towards the intestines. From intestine, I'll show you over here. So basically, you will have a drug. Once you take it, it goes in orally, and it will enter the stomach. Everybody see? From the stomach, two things will happen. It will either go into the small intestine, or it will break down through the stomach acids and through the stomach lumen or lining. Once it goes into the small intestine, it will again get broken by the enzymes inside our small intestine, and then it will. So basically, when we eat, this will be our stomach. If this is our oral, this is our taste. It's not perfect, but you will take a medication. It will go there. When it reaches the stomach, it can either pass through the lumen. If it is too small, it will pass through the lumen, or if it will go into the intestine, the lining of the intestine will help it pass, and then it will enter the liver, and this will, inside the liver, it will get broken down, and I will explain how it gets broken down. Once it enters the liver, it will further break down, and then it enters the circulation system through the hepatic vein or the portal vein, and it then goes to the systematic circulation. So I told you how it reaches to the liver. So first thing will be the drugs are absorbed to the bloodstream from the gastrointestinal tract, as I just explained. Then they will travel into the bloodstream. Arriving in the liver, the bloodstream carries the drugs to the liver, which acts as the primary site for drug metabolism. In how the drug is metabolized is done in two phases. One is phase 1, this is oxidation, reduction and hydrolysis. In the liver cell, drug molecules undergo phase 1. This includes oxidation, reduction and hydrolysis. Cytochrome P450 is a very important enzyme. This basically helps break down the drug molecules into metabolites. These are basically small particles of the drug, but the potency is reduced. So our liver basically breaks it down, and it is not that effective. And then it reacts with oxygen, so it gets oxidation, and then it making water soluble, and then if the metabolites are broken, the bloodstream will carry it to our kidneys, and from the kidneys it will be eliminated through the urine. But if it is not broken inside the liver, it will enter the bloodstream, and from the bloodstream it will travel to the affected site from where the medication is used. Very common example will be the painkillers. If you have any pain in the body, the drug will travel to the site. Second is phase 2 is of metabolism is conjugation. The following phase, the drugs may enter phase 2 known as conjugation. This phase, the drug and metabolites combine with certain molecules. The glucuronic acid, sulfur or amino acid further increases water solubility and facilitating elimination. Forming of metabolites. The combined actions of phase 1 and 2 result in the formation of water soluble drug metabolites and are generally less pharmacologically active. As I just explained, if the enzymes in the liver break down the drugs, they are not as effective. And then it is excreted. And one more thing that happens is that biliary excretion. Some metabolites may be excreted through bile into the intestine. So if the particle is too big, not able to enter the bloodstream, it will pass along with the solid fecal matter. And this will happen through biliary excretion. Now, what are the factors that affect drug absorption? So, as I said, drug absorption, most of them are taken orally. Just as I said, everybody has different genetic composition, so not all drugs dissolve at a certain time, and secondly, not all drugs need to be released that quickly. So if the acid of the stomach is too strong, some of the medication not be as effective. Because that is why we have different forms of medication. Some may be in tablet form, some may be in capsules, liquids or other formulations. This will help and protect the tablet from the enzymes inside our GIT, and it will allow them to stay effective till they reach the intestines, or to save them from the filtration of our liver. And then we have the small intestine. This is the primary site for all the drug absorption, because the small intestine has a larger surface, so medication can easily absorb from there. So this starts at the duodenum and the jejunum. Then the inner surface of the stomach is covered with small, tiny finger-like projections called villi and macrovilli. This basically helps pass the particles through them. The passive diffusion is obviously if the bloodstream has no drugs or less amount of drug. Obviously the intestine has a high concentration, then automatically diffusion will occur and the components or the particles of the drugs will pass on to the bloodstream. But this may not be the case at every time. Different drugs require different energy, so there can be active transport in which the carrier proteins in the bloodstream will help the particles to travel throughout the body. This process requires energy. Then there is the facilitated diffusion, in which we use the proteins without expending any energy, and the concentration gradient plays a factor in this. The gastrointestinal blood supply is always having capillaries that help with all the absorption, so the blood can easily distribute in the bloodstream and throughout the body. As mentioned, the absorbed drugs are then carried via the portal vein to the liver before entering the systematic circulation. And what is first pass metabolism? So basically, when a drug is being broken down, it is in high concentration, and the liver is not able to filter and break down all the components in one go. So if it can be possible that at least 50% will be broken down while 50% will still pass. So when it enters the bloodstream, it will travel, and when, like the example of the painkiller is that if anybody has any pain, the body gives a signal that there's pain over here. The drug has the receptor to go and receive those signals, so it will attach to the site, and it will keep attaching till the signal is quiet down, till now there's no need of any other substance. The molecules that attach at the active site, they will be taken back through the bloodstream to the liver, and they will keep on breaking down until all the drugs metabolites are excreted. So this is called first pass metabolism. And then there is bioavailability. So bioavailability, it's basically the fraction or percentage of drug that reaches the systematic circulation. That is known as bioavailability, because otherwise everything is turned into metabolites. How are drugs eliminated? So these are 4 common ways of drug elimination. Number 1 is the body removal is done through urine, feces and other pathways depending on the chemical properties. Fecal matter, as I said, if the particles are too big, they will travel through our GIT and they will come out as solid fecal matter. Second is renal excretion, which is the urine. If the metabolites are broken through the bloodstream, they will go to the kidney, and from the kidney they will be excluded through the urine. And the other pathways can also include sweating or salivation, when the excess amount of drugs are disposed of from the bloodstream. It is important that all such drug matter is taken out from our body, because if the liver is not able to do its job properly, all this will accumulate, and longer stay of any drug can lead to toxicity. Therefore, it is important that all such drugs are excluded from our body at the earliest. So anywhere from a few minutes, like to a few hours, the body starts working to eliminate the drug already. This can be affected through each person's own metabolism, the connection. The metabolites are more easily eliminated from the body, the individual variability. Each drug, obviously, according to our physiology and our genetic makeup, depends on how quickly or how slowly the medication is processed and how much effective it is to us. It is better that after giving any medication, healthcare providers should monitor the drug levels to see if the drug is being eliminated on proper basis. Number 5 is genetic and age factors. As said, each body is unique and so are the drugs. The individual makeup or the unique genetic composition influences how our body responds to medication. Impact of medication, these variations significantly affect how drugs are metabolized and our overall effectiveness. The potential side effects, as I said, if drugs are overreacting or are not able to comply with each other, they will give us side effects, and we need to make sure that such side effects do not take place. Cytochrome P4 is a variation in genes encoding cytochrome P450. Enzymes can influence drug metabolism. This is the main enzyme that helps with the breakdown of the drug. And then, as we are approaching new treatment, with the knowledge of how our genetic makeup is able to effectively eliminate drugs and metabolize them, we can improve our systems. Other factors that affect our drug metabolism are age factors. So if a body is too young and it is not as prepared for immunity against pathogens and toxicities, then maybe even the slightest variable dosage can have a reverse effect on our health. It is better that we know the drug sensitivity, we know the challenges of polypharmacy. Polypharmacy means multiple drugs. So if there are multiple health issues in a body and we are treating them, multiple drugs are taken. It is important to understand the chemistry and the interactions of different drugs and how they will react inside the body, so that we do not end up harming ourselves even more. And then we have the individualized prescribing considerations. This is for older adults considering their unique responses to medication. Given their history, we will, as a person will age or any living, we will get to know how they react to each drug. So a personalized healthcare can be made depending on what's their history and what's their interaction with drugs. This can help in improving life quality. Drug interactions. So these are this is the basic of drug interactions. One is additive. Additives effects occur when the combined effect of two or more drugs is equal to the sum of their individual effects. So basically, I have given an example that acetaminophen is a pain relief, and it has the same effect as an ibuprofen, which is also a pain relief. So if you have both, they exhibit additive effects providing a combined energy. Obviously, you can say that you are taking two types of things to boost the same kind of thing. So this is like a boost. If one is already there, there's no need for the other drug. Then you have synergies. Basically, this effect occurs when the combined effect of two or more drugs is greater than the sum of the individual effects. The combination of alcohol and certain sedative medications can have a synergistic effect, leading to an increased central nervous system depression. Obviously, this can be harmful if we give too much relaxant to the central nervous system. This can lead to paralysis, coma, or other issues. So we should not even overdose the body. And then we have the antagonist, which is the effects occur when one drug diminishes the effect of another, either by blocking receptors or by opposing physiological actions. So naloxone is an antagonist used to reverse the effects of opioids. Opioids are also a form of painkillers. By binding to opioid receptors, preventing the activation and mitigating respiratory depression. So if you give two drugs which cancel each other out, this will not give us any effect, and in fact it will just harm us. Here are some common interactions more. There are two types of interactions common. Drug on food. So basically, as we know, even food has different types of enzymes, proteins and chemicals that can, along with the drugs, react with each other. I have given example of drug on food and drug on drug. So drug on food is like consuming grapefruit with certain medication like statins or some anti-arrhythmias can lead to drug-food interactions. Grapefruit juice inhibits the enzyme responsible for drug metabolism, resulting in increased drug levels in the bloodstream and potential adverse effects. So obviously, you need to be careful, and you should know that each food food that we are having can also affect the drugs taken in. So we should keep in mind that they do not interact with each other and cause a chaos in our body. Another example is drug on drug taking warfarin, a blood thinner, alongside aspirin, a non-steroid anti-inflammatory drug, NSAID, can lead to an increased risk of bleeding. Both medications affect blood clotting and their combined use may intensify this effect, posing a higher risk of hemorrhage. Obviously, if you are having too many blood thinners, your body loses the capability to clot. Any form of small cuts can lead to excessive blood loss also, so this is a very dangerous condition. Why is it so important to know the importance of personal health? As stated before, it is important that we understand that drug interaction facilitates personalized healthcare. If we know how our body is reacting to each drug and how our drugs are affecting the body, we can improve our life quality, we can have proper treatments for diseases, and we can have better lives, and we can live longer lives as well. The awareness of health conditions. If we know any condition is crucial for making informed decisions about medicine, it allows individuals to actively participate in their healthcare, promoting a proactive approach to managing health. And lastly is our recap. So, as stated, the drug effect, it is crucial to know medications, intended and unintended uses. Drug metabolism, we should know, as given the example, the liver plays the main role in metabolizing all the drugs that enter our body, but there are effects on it that can be done through factors affecting on it, that is from absorption, the elimination, the genetics, and the age also play a huge factor. Then we have interactions that alter drug effectiveness, additives, synergists, and antagonists. Drugs and food impact absorption. Then we have the knowing how drugs work, common healthcare decisions to optimize healthcare. We have drug absorption, the common routes, and then we have drug elimination, which is, as stated before, through fecal matter, urine, and even sweat to remove toxicity. And then we have genetic variations. Each body is unique, and so other drugs, they have different effects on each other. And then the importance of knowing all this and having the awareness of the drugs and our genetic makeup. Any questions?